The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and NeuroCare Centers, and our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist and the manager of our New Philadelphia store, and our special guest, Dr. Brian Amison from Amison Dental Group. Good morning and welcome to the show, Doctor.
Thank you very much for having me today.
All right. General dentists are the primary providers for dental care in patients of all ages. From children to seniors, dentists treat the entire family for overall health care, which is crucial to mouth and general health. So when it comes to baby teeth, sealants, root canals, and beyond, regular dental care can not only treat problems, but also prevent many issues, from cavities to gum disease and beyond. Today we're going to talk about general dentistry and some of the conditions that people might not be aware of and what they should see their general dentist about. This morning, the show's live on Facebook as well on the radio, and you can also go to your favorite app store and look for Health Matters with the Medicine Center Pharmacy and download our show and take it with you wherever you go. So for that last-minute vacation this summer, while you're rolling in the car, you can download this show and take it with you and learn a little bit more about general dentistry.
So, I would imagine, Doctor, that you get a number of patients who wish, visit you on a regular basis, and others who just kind of show up. What would you have to say to balance this group of patients?
Well, dentistry is more of in my opinion, a preventative occupation. So, people say, "Oh, I'd rather, have a baby than have a root canal. I'd rather have, my leg fall off than come see the dentist." We get that, but again, if we take care of things early and a preventative measure, then it's not bad at all.
I've had 3 or 4 root canals, and it always was the first one I ever had. This is absolutely terrible. This is awful. And I guess I really didn't think, with the anesthesia products that you use, I really didn't think it was frankly, that bad.
Well, I can speak firsthand because being a dentist, I've had a root canal before, and typically people will say, a bad experience for 2 reasons. One is because it's swollen and they're already in pain, and 2, they'll say, "Oh, the tooth broke off." So again, dentistry and root canals today shouldn't be associated with pain at all.
Right. So if people aren't experiencing any pain, is there a misconception that there isn't anything wrong?
Absolutely. I was just talking about this a little bit earlier, where, again, even though it doesn't hurt, if it doesn't hurt, you still have to take care of it. And if you take care of things early, then you can, again, eliminate pain and, quite honestly, costly procedures down the road.
So we have to have regular dental visits. Why is that important?
Well, I say the mouth is a gateway to the rest of the body. People will, again, a lot of times we can look and we can see things that, for instance, like diabetes or sleep apnea. Even though we can't diagnose that, we can see signs of that. So, again, if you come as a preventative measure, I've sent a lot of our patients to say, look, you need to see your primary care physician, or you need to see someone even before they realize they had a condition. So we do look at more than just the teeth.
Okay. Some things that occur, you knock your teeth out, kids knock their teeth out, whatever. Can we rebuild a tooth now? Can we put it back in?
You can. If it's a baby tooth or primary tooth, typically you'll just kind of let it go. If there's any doubt, just call your dentist right away as soon as it happens. And now is a time of year where, again, summer, people are out and there's accidents, even though people or kids do more than just play Fortnite, hopefully, but they're outside, things happen. So if you have an accident, just please go contact your dentist as soon as possible. And with some of the things that we have nowadays, we can save teeth that we couldn't have saved 10 years or 20 years ago.
Okay, what about baby teeth? In my past, baby teeth were ignored pretty much, when I was young. unless there was a real big-time problem with them. But now they're suggesting that it's important to take care of the baby teeth. Why is that?
It is. It's pretty much kind of like a prelude to your adult teeth. So, if you have two chances. So you really want to take care of your baby teeth. But we as dentists, if we see that there's an issue with the baby teeth, hopefully we can get more preventative so that it doesn't occur with the adult teeth. Because once adult teeth come in, that's it.
This might be the biggest question of the day. How do you keep your teeth the rest of your life?
Well, eating
or
right.
for a lifetime.
Okay, right.
Okay.
Right. Eating right, brushing, especially, everyone loves to hear this, flossing. We were talking earlier, just floss once a day. It takes 30 seconds. We'll say a minute out of your day. And they've shown studies where if you floss on a regular basis, some studies show that you can have up to 7 more years of living, which amazed me. Because you'll be amazed. I mean, we all have done that. Sound crude. I know it's early in the morning. But it's, when you brush your teeth and you floss and you have all that lovely stuff on your dental floss, imagine that's in your mouth.
Sure. So would you say that flossing before going to bed is probably the best?
Absolutely. Because, again, when we brush, you can brush, but you still can't get in between your teeth. And, again, we all know that. You eat that meal and you brush, and then you still have things between your teeth.
Yeah.
By getting those areas clean, it's basically, I always tell people I wish that the teeth were separate from the body. Unfortunately, everything is all connected. So if you have an infection in your mouth, it's going to travel all over. And, you've seen the studies with, gum health and oral health and heart disease. So it's really important to make sure you get as much of the bacteria out of your mouth as possible. And flossing helps to do that.
Okay.
You mentioned earlier that your mouth can be a window to some other chronic conditions going on. You mentioned diabetes, and you mentioned some other things. What kind of experiences have you had as a dentist to help people identify something that they didn't know they really had going on?
Within the past few years, a condition called sleep apnea, and with it being the Hall of Fame, I always think of Reggie White. And that was one of the factors that played into his death, sleep apnea. And basically, it's when you don't breathe for a period of time. So we as dentists, we can look, and again, we're not able to diagnose it, but we can see signs and symptoms. You'll see, patients will come in, A, they're really, really tired, or B, from a dental perspective, we see the teeth shifting and teeth chipping. And again, it goes beyond, just typical clenching. So it's really, we can look at that, and then we'll say, hey, you need to go get a sleep test to make sure definitively that you don't have sleep apnea. And we did have a patient come in and had evidence of that, and he he was not very happy with me. He was like, no, it's not happening. You don't just deal with my teeth. Long story short, he finally went to go see his physician, and he had one of the worst cases of sleep apnea that he had ever seen. He had, I guess, awakened over 1,000 times at night. So imagine for a 7-hour being up 1,000 times a night.
We didn't sleep at all.
Exactly. So now, every time I see him come in, he kind of smiles, says, look, I'm sorry I gave you a hard time. And it's, well, hey, no worries. And his quality of life is much better. He saw his primary care doc and has a CPAP machine and is doing well. He said that's the best sleep he's ever gotten. And you just don't realize, how important sleep is until you actually get it and realize that, wow, I wasn't sleeping. So that's pretty rewarding for us.
So he told you that he was waking up that many times, or
No, he after the fact, because he went to go see his physician, and the physician, when he did a sleep test, said that.
Okay.
So
because they've got the sleep clinics all over. There's one, a couple down the road here, and there was one at the airport. I don't know if that's still up there or not.
Okay.
And Mercy's got one. Almond's got one. I would suppose about every hospital institution has a similar.
Interesting. You can see evidence of that, though. So that's just really interesting.
We're going to take a break now.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
This weekend is Ohio Sales Tax Holiday, and you can save big on school supplies at the Half Off and Hot Buy store in Louisville. This Friday and Saturday, shop for your school supplies and clothing at our discounted prices without paying tax. You'll find calculators, paper, glue, poster board, notebooks, lunch boxes, and more. Stock up on diapers for adults and children, shoes, hosiery, and other clothing items tax-free. Why pay more when you can shop for less at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Visit halfoffandhotbuys.com and follow us on Facebook and Instagram.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Medicine Center Pharmacy was named the 2018 Best of the Best Pharmacy, and we'd like to thank our customers and our staff for the honor. Our 13 pharmacists in Canton, Louisville, Minerva, and New Philadelphia help keep you healthy and save money, from free kids' vitamins to compounded prescriptions and affordable diabetes care. Ask how we can help, and don't forget, we have free screenings at our pharmacies on Tuesdays. Call 330-454-8772 for more information or visit medshoprx.com. medshoprx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. We're talking today with a very fine dentist, Dr. Brian Amison. Have a question, give us a call at 330-450-1480 or post your question on the live Facebook feed.
Okay, over the break I had a question come in, and they wanted to know how early should you send your child to see the dentist? So what's a first age visit, and what's it look like?
Wow, so typically it's about 3 to 6 months after the first tooth comes in, so that could be even a year old. So the first visit, we don't expect the little one to sit in a chair for an hour, half hour, basically just to kind of look around and to see if there's any obvious problems.
1-year-old, can you even get them to open their mouth for you?
That's always a challenge too, but typically we'll have like the parent come in and just, even if they cry a little bit, you can at least look inside and just make sure that they're doing the right thing. A lot of us, we think, okay, milk is good for us, which it is. However, milk has sugar in it, so if that sits on the teeth, we've seen patients come in as early as 2 years old with all their teeth rotted out. So, so typically like 1 year old, and then also it's a time to educate the parents as well. Okay. And plus you get them used to sitting in the chair, like I said, 1 year old,
right?
Exactly.
All right. Well, very interesting. Okay. You kind of touched earlier in the program, we're coming into, right now we had a bunch of people preparing for the parade tomorrow, and there are marching bands, and we've got football practices starting. You mentioned earlier what to do if you have an accident with your teeth, whether you chip it or you have one fall out. What's the best practice if you have an emergency that's tooth-related, and you're maybe a student athlete or something, and what would you recommend that the child and the parents do?
Sure. The first thing is to, if the tooth does come out, to try to put it back in. Don't necessarily try to scrub the tooth. Maybe if you have water, just rinse it off. Unfortunately, if it's in dirt. But you want to go ahead and give your dentist a call. Obviously, talk to your trainer first, but give your dentist a call as soon as possible, because time is of the essence. If you can get the tooth placed back in within an hour, there's a good chance it's going to be saved. If not, then you can potentially lose it. So, yeah, really important. Time is of the essence.
Okay. What about, I guess in the spirit of putting teeth back in, that makes me think of implants. So what is a tooth implant, and in what avenue are those used?
Sure, absolutely. We've really come a long way within the past 10 years with dental implants. Dental implants are a replacement for your natural teeth. Now, I will say there's typically nothing as good as what you had in the original hardware, but having a dental implant can really changed people's lives. From a single tooth implant to patients who unfortunately have conditions where they lose all of their teeth and they have a denture. And I think we all know that person with a denture. God rest his soul, my grandpa had a denture, and he'd keep pushing it in and out, and it would kind of freak me out, quite honestly, as a kid. Like, well, how can you do that to your teeth? But with implants, we can actually strategically place implants and place a denture on top. And the denture is so tight that you have a hard time getting it out. I had a patient just last week, in fact, who's completed that, and he's had a denture for years. And with the implants, he's looking at me, he's trying to get it out, and he's just really trying to. And eventually we got it out. It was good. He was able to get it out, but he's like, "Oh my gosh, I can't believe how tight they are." So,
you mean an actual implant in the jaw you're talking about? Or?
Correct, right. We'll place typically for the top, 2 to 4, and the denture actually snaps onto the implant itself.
Okay.
So it works really well. I mean, obviously we want our patient to have their natural teeth, but that's a definite alternative for those who don't.
Okay. I have one. Okay, I'm getting another one. There's no reason to take them out. A single tooth, right?
Correct. Or a single tooth implant, that would be similar to your natural tooth as you can. So no, you would not take that out.
As I recall, the tooth was actually screwed on it like a bolt into a nut. Is that
right? But
correct?
Please don't go to Home Depot and try this at home. Okay?
I know.
Could be cheaper. But
in going through the process, I thought, this is kind of interesting. You put some new bolts in your mouth, and you're ready to go.
Right. It has come a long way with implants. So it's definitely a nice alternative, and for people who have missing spaces, and instead of having to do a bridge and cut down 2 healthy teeth, you just place an implant there as long as you're healthy, and works well.
Okay.
How about cosmetic care for things like braces? If there's ever a challenge to floss or to clean your teeth, when you put a whole bunch of metal wires on there, that certainly creates a barrier. What do you recommend for people that have braces and regular dental care?
Well, with that, I recommend just really, as you said, doing a meticulous job, keeping everything nice and clean. There's other alternatives out there, too, for braces. There's a product called Invisalign, where basically it's clear aligners, almost like a football mouthpiece, for lack of a better term, but it's custom fit to your mouth. And the good news about that is you can actually take them off to clean your teeth, so you don't have to worry about the metal. But if you do have to have the metal braces, it is really important to keep your teeth as clean as possible. Because again, we see patients come in, and unfortunately, particularly the younger patients who don't maybe aren't as motivated, and they'll have their braces off, and it's a cosmetic. I mean, they look great. The orthodontist does a great job straightening them, but if they don't keep them clean, you run into a nightmare cosmetically.
So you can have long-term issues if you're not diligent while you're wearing your braces.
Absolutely.
Or at least visually.
Absolutely.
Okay.
Correct.
Okay. Well, you mentioned a mouth guard, or the Invisalign's kind of like a mouth guard. How about mouth guards in sports?
I definitely recommend that for any sport. And they used to talk about like soccer, and it's typically used for football, but soccer, basketball, lacrosse, even like softball and baseball at times. I feel it's really important to have a mouth guard.
We got about a minute left in this segment. Can we talk about, when we come back, we talk about the controversy, I don't know if it's even a controversy anymore, amalgam tooth fillings, porcelain tooth fillings, that sort of thing, okay? Gold was used at one time for fillings, which of course is not cheap. I don't think I know anybody with a gold tooth, but or was ever talked about, I prefer gold over over porcelain or over amalgam or whatever. But most of my fillings, as I grew up, of course, were the amalgam, mercury, not silver.
Correct. Right, mercury and silver, yes.
Okay, all right. So anyway, that's it for this segment. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The summer driving season's here, and it's the perfect time to shop the largest auto mall in Northeast Ohio with one click at Kempthorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, and Sprinter, too. Something for everyone's price range. Kempthorne.com makes shopping easy, fun, and friendly. We also have a huge selection of pre-owned vehicles, and less than stellar credit is never a problem. The Kempthorne family name's one you know and trust. Committed to our community for over 80 years. Shop Kempthorne.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
This weekend is Ohio Sales Tax Holiday, and you can save big on school supplies at the Half Off and Hot Buy store in Louisville. This Friday and Saturday, shop for your school supplies and clothing at our discounted prices without paying tax. You'll find calculators, paper, glue, poster board, notebooks, lunch boxes, and more. Stock up on diapers for adults and children, shoes, hosiery, and other clothing items tax-free. Why pay more when you can shop for less at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy? Visit halfoffandhotbuys.com and follow us on Facebook and Instagram. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are talking with a very famous dentist from Maslin. Maslin?
Canton.
Okay, all right. Dr. Brian Amison, and we're going to talk now about amalgams, porcelain, or gold fillings. Okay. What's the difference?
Okay. Well, there was a big controversy years ago about amalgam or silver fillings, and I'm not here to get personal or anything, but silver fillings. People are saying remove your silver fillings and you'll relieve every ailment possible. I respectfully disagree with that. Amalgam fillings or silver really don't need to be replaced unless there's a problem, and typically over time they start to wear down. So if you think of like your house and it starts to settle and then you get like tiny little cracks, anytime you have a crack, then it leads to bacteria getting underneath that silver filling. So that's when they need to be replaced. If someone comes in and says, hey, I have all these silver fillings and replace them for me, doc, I'll respectfully say if they're intact, well, this isn't the place for you. Some people do that. Again, it's not right or wrong, but it's just our philosophy. And you had asked about, porcelain and gold fillings. Now, gold is the quote-unquote gold standard, quite frankly. It's more like natural tooth structure. Now, if we can come up with a way to make gold tooth-colored and that would be the perfect dental material. But we do have a lot of good materials out there, porcelain. And now we're getting away from, before we used to use a porcelain fused to metal. So basically you'd have a metal which is black, then you would kind of bake the porcelain on. Cosmetically, it would function well, but cosmetically wasn't the greatest. Now we have these metal reinforced materials that are they are white, so you don't have, we've all seen the person who has that front tooth and it looks like it's kind of dark at the gums, and you kind of look at them and say something's not right. Nowadays you don't need that dark metal underneath.
So now are you saying that the porcelain tooth is still metal with a porcelain coating, or what are you saying?
No, they do have those, but now they're getting to the ones where the porcelain is actually all one unit, so it's not baked onto the metal substructure.
Better, or
it's better in that it won't, typically it won't chip. And if it does chip, you don't see that dark undertone that you do with the porcelain fused to metal. Like crowns, typically we used, 10, 20 years ago.
Okay. And most dentists don't make their own teeth. Is that correct? Their own?
Well, it depends. We do have a system where basically it's a CAD CAM. So basically it will actually mill your crown while you're waiting. So some dentists do have that technology to do that.
And you get the blanks, is that correct? And you mill the blank? Or
correct, okay. Right. It's basically it's a piece of kind of like that porcelain, and it just basically it just mills it. And for the engineers, they would love watching that. Some people actually love, when we start making someone's crown, they'll say, can I watch it? Sure, there it is. And,
interesting. Funny. So you're not going to print them off the printer, huh?
People do that as well. Not necessarily the crowns yet, but it's coming. Those 3D printers.
Big controversy with printing guns. I saw in the news, come on, you got enough guns. We don't need any more guns. Okay. What's the percentage of dentists you think you can actually use or do gold? You don't come out of dental school now.
Well, it's been a long time for me coming out. We used to actually have to make our own crowns, and we would actually cast them. So we would wax them and do the metal, and it was just an interesting process. So I don't know about the newer graduates there. They still learn it, but it's probably not as prominent as when I was in school.
So you're saying you have more experience now than the newer grads because you had to do the stuff the hard way.
Right. I know. I can finally say that. I've kind of had that transition from the young dentist to the more mature dentist now.
There you go. I like that.
So okay, you make a gold crown, all right, or you wax it, you form it or you mold it or whatever, but you still have to shape it, right?
Correct. Right. Going back, if you'd asked my wife, I remember when we were first married, or in school, she would watch me and she'd say, how can you do that so meticulous? And you drop by drop by drop. So
did you save the gold fillings? The gold
Well, there was one time when I was working down at Ohio State and the gold actually went flying. And gold is pretty hot because when you melt it.
Yeah, sure.
So fortunately, when I tried to grab it, my hand hit the desk and I couldn't grab it, because if I would have grabbed it, I probably would have had a hole in my hand.
Yeah, sure.
Oh, wow.
Well, there used to be a watch factory here in town, Duberham, the Watchworks, and many of the watches were gold. And they used to tear up the floorboards, so the story goes, every few years, and incinerate the floorboards to get the gold back.
Oh, I don't
that's
doubt it.
nothing like the tooth thing where the little scrapings, what you're doing on a small tooth. But if you can imagine hundreds and hundreds of people working at this place, working on gold cases, shaping them and filing and all that. So that's a story I've heard for years. I am not sure it isn't a rumor, but it makes sense.
Correct.
Because they had no lights. In this factory, the windows were floor to ceiling. Okay, and the watchmakers' benches were in front of the windows. Their day ended at 3:30, and of course you couldn't have 6 shifts or 3 shifts or whatever because they didn't have. And I have some pictures of inside of the factory, and there's 2 light bulbs in this big factory, and I'm thinking, why did you even bother?
Wow.
But anyway.
Wouldn't be very productive during the winter, I guess.
You wouldn't want to fix teeth that way, would you?
What do you think's coming in filling, whatever, composition, port? Anything new off the...
I think just with all the biomaterials that, quite honestly, at some point we'll be able to take some cells from the actual patient and engineer them to actually make a tooth. Wow. Because the bad thing is with teeth now, the enamel, the hard part of the tooth, once it's made, it can't regenerate. So if you can genetically engineer it so that it can regenerate, theoretically, we wouldn't need any gold. We wouldn't need any porcelain. We could just regenerate your own natural enamel. So there's a lot of smart people working on that as we speak.
Wow. Well, I've told this story to every dentist that's ever been on this show, and my neighbor that I grew up with, they pulled his wisdom teeth, they grew back. They pulled his wisdom teeth, they grew back. They took his tonsils out, they grew back. They took his tonsils out, they grew back. Okay, maybe we should have taken some DNA from this guy or something.
Exactly.
Or whatever.
What were his triggers?
To figure this thing out. So finally, they just gave up. They didn't take them out anymore. They figured if they take them out again, they'll just grow back again. So I guess another thing I on the television on the tube, there's some advertising. I don't know, dentists, I suppose, that are saying for false teeth. Okay. That their technique is to place like 2 or 3 posts on the top and 2 or 3 posts on the bottom, and the false teeth just snap over top of them. Is that something better than,
Well, I know there's a niche, and though, some people advertise, dentures in the day, that can happen. It involves a lot of pre-operative work and using, kind of like 3D printers and CAD CAM. So it can happen. Again, we're getting closer and closer to that on a regular basis. We'll do that, as I was mentioning earlier, with the patient who just did the dentures on with the implants. It was a little bit longer process, but the same kind of theory there. 4 implants and then placing the denture over top, and then it's very secure. So there are places out there who do the dentures in a day, but it's you just don't go in like that day and say, okay, I want teeth, and you eat it. It's a little bit more involved process, right? It would.
That's kind of how it's portrayed. I mean, that's a little drastic, but okay. We got a minute and 45 seconds left in this segment. What about liners? You hear all these ads about, this works better for your false teeth to hold your teeth in place. I can't tell you the names of them. Apologize.
Right. Well,
yes, no, or are they?
That's kind of a temporary fix because if your dents are getting loose, just like your body, you can lose weight, gain weight. So if your dentures aren't fitting well and you're using more of that material, that's an issue.
Well, as you age, does not your jaw shrink?
It does.
Somewhat.
It does.
I mean, I don't know if
Correct.
It's everybody, but I guess I think that would be a real problem if you have dentures.
Correct, and that's why even, like I said, an implant will support the dentures and tend to keep the bone at the same level. It's kind of like if you would plant, you have a flower bed and you had, a tree in it, the tree would hold that dirt in, but if you didn't have the dirt you put water on it, it would just wash it away. So that's similar to your bone.
So with an implant, you wouldn't expect, let's say, the two teeth around it as well as the implant, that you wouldn't expect them to shift even in a jaw shrinking.
No, you should be able to keep, the majority of your bone. You may have some shifting or shrinking, but you should be able to keep the majority of that bone.
Huh, that's interesting. Okay, time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
This weekend is Ohio Sales Tax Holiday, and you can save big on school supplies at the Half Off and Hot Buy store in Louisville. This Friday and Saturday, shop for your school supplies and clothing at our discounted prices without paying tax. You'll find calculators, paper, glue, poster board, notebooks, lunch boxes, and more. Stock up on diapers for adults and children, shoes, hosiery, and other clothing items tax-free. Why pay more when you can shop for less at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Visit halfoffandhotbuys.com and follow us on Facebook and Instagram. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We've been talking about dentistry, and there's a local event, Dentistry from the Heart, coming up. So we're going to talk about that with Dr. Amison. So we are now back to the last segment of the show.
Okay, Doctor, why don't you tell us about your community involvement and the special event that you have at your office coming up at the end of August?
Okay. Well, I am truly so excited about that. It's our 5th annual Dentistry from the Heart. And basically it's where we give back to the community, because this is a great community. And what we do is we partner with myself, Dr. Frank Bertolini, and Dr. David Ash, and we'll provide free dentistry for anyone 18 and over, the first 50 people to come in. It's either a cleaning, a filling, or an extraction. And it's just been incredible. This will be our second year having it on a Friday. And last year, again, we see the first 50 people, and it's from 8 to 12. We had 50 people probably by 9 o'clock lined up. We've had people it just amazes me that we've had people come from Cincinnati,
You're kidding.
And it was amazing. That wasn't the furthest. First, we had someone come from Louisiana, and they come like 3 years in a row, and they were like one of the first people there. So, the need is great, and it's just a small way that we want to give back. So again, please, if you know of anyone, please come early. It's August 24th, which is on a Friday from 8 to 12. But like I said, please come early.
Geez, that's amazing.
So you probably, do you have info on your website, or do you have a phone number you can throw out if people have questions or...
Sure. You can look on our website. That's AmisonDentalGroup.com. It's on there. And also, our phone number is 330-452-2255. Now, you don't have to, just go on the website and you'll get the information there. Or even if you look at Dentistry from the Heart, and that's the website, you'll see information about it there as well.
Okay, very good. I'm thinking in the pharmacy we have a lot of screenings. We have blood pressure screenings and cholesterol screenings and even diabetes screenings. I'm thinking that this event is almost like a mini dental screening for you, for help raise awareness for what's important and help people identify a problem that maybe they don't know they have. Is that a stretch? Or
well, no, that's not a stretch at all. And in fact, we've actually had to turn people away, and the reason why is because we take their blood pressure. And we had a patient whose blood pressure was 200 over 110. Ooh. And she had no idea.
Wow.
No idea. I'm just like, well, can I just get my teeth extracted? I'm like, or tooth extracted? I said, well, that's important, but we need to get this checked out right away. So even in our normal practice, we'll take blood pressure. And we had someone it's been about 7 months ago, came in. Blood pressure was 190 over 110. And had no symptoms at all. So... he's like, I'm just here to get my teeth worked. I'm like, we understand that. So long story short, he went to his physician, and he could have had some serious consequences had he not gotten it taken care of. So again, I keep seeing it. It is not just us, just dentists in general. It's more than just the teeth.
So tell us about the process with a patient, okay? Like, sorry. I come there, okay, I got a bad tooth or something like that, and you're going to take my blood pressure. Is that the first move?
Typically, we would, show you around and just kind of ask, questions and, ask, are you taking any medications or anything? And then, then we'd go ahead and take your blood pressure and then get a picture to see what's going on with your tooth and how we can help you. So
you don't do like a full x-ray, all the teeth. You just treat the problem.
Essentially. Right. It depends, because a lot of times people will come in for one tooth, but we'd like to get an overall view of everything. Now, again, worst case scenario, say someone needs multiple extractions and they're very nervous and they want to be sedated. It's not going to help them necessarily if I go ahead and do this one tooth and then have to go and have it redone. So ideally, we'd like to get away from, we want to take care of the patient's primary concern, absolutely, but we want to kind of take it in context with the general health, both oral and overall health of the patient.
So what about, do you look at the lining of the mouth, maybe you're looking for oral cancer or anything like that?
Yes, we do. It's been really big lately, human papilloma virus, which causes warts. And they've shown that to cause oral cancer. And before, 20 years ago, we think of oral cancer as some older guy who smoked cigarettes and drank a lot.
Yeah, chewing tobacco, whatever. Sure.
Exactly. And that still exists, but now you'll see, 20-year-olds, and younger who don't necessarily smoke, don't drink, who have a spot. And I always tell our patients, if you see anything red, white, and blue in your mouth, so think of the American flag, if it's there for longer than 2 weeks, you need to have it checked out.
We used to sell, I think we still do sell, like dental mirrors and, things like that for people to do sort of a self-examination.
Right.
I always think, okay, how do you do that? Do you refer these people to dentists? Okay, so you find somebody who really needs some work, who has a serious problem. Do you do a referral?
It depends. If it's something where it's like an oral cancer, then we would refer to our oral surgeon. to take a closer look at it. We can do some preliminary tests where we can basically swab the area and send it off for analysis. So we do. I kind of think of as general dentists as being kind of the quarterback. We can send you this way or send you that way or take care of it. So it just depends on the situation.
Okay.
How about you give another shout out for your Dentistry from the Heart event coming up at the end of the month, and give your contact info again, and maybe if you have a rewarding experience that you recall, just for a inspirational message, if you will.
Okay. First of all, I thank both of you for having me here. Really appreciate it. You guys do really good things for the community, and I thank you for having me on and for being able to talk about dentistry. But for our event, against Dentistry from the Heart, and that's August 24th.
Is that a national program?
Yes, it is. It's a national program. So it'll be from 8 to 12. Again, please come early because first 50 people are guaranteed to be seen. And you can get more information on our website at Amison Dental Group. That's AMISON Dental, DENTL, group.com.
At your last event, how many people did you see?
We saw 70 people, I believe. Wow. Because we had the supplies, and it was really nice to see. I mean, and people are so appreciative. And just if I can give like a little quick shout out, again, what I want to do is what our practice prides itself on is to give back, but also we want people to give back as well. So this is no money. No, don't bring any money. We don't take any donations. But all I ask is for people who come, maybe you do something nice for someone else. I mean, you can hold the door open. You could, as cheesy as it sounds, you can smile. You can do something nice for someone else to help make our community even better.
Very interesting. 70 people. How long? What's the time frame? How long?
From 8 to 12. So
4 hours. Holy smokes!
and everyone who volunteers, not just the dentist, but the assistants and the hygienist, and we've even had patients volunteer. It's a lot of work, but at the end of the day, you just feel so good that you've helped. So we're actually, if you're even interested in helping, just witnessing it, please give our office a call, and we'll find something for you to do. I promise.
All right, that's kind of cool. Okay, that'd be interesting for sure. Date again.
Okay, yes, it's August 24th, which is in a few weeks, from 8 to 12 at 3684 Dressler Road, next to La Pizzeria.
Oh, okay. That's a way to recognize it, isn't it? Okay. Any comments in the last 30 seconds?
Like I said, again, thank you both for having me on. I really do appreciate it, and looking forward to a great year. The Browns. I don't know if you guys are Steelers fans or not.
Man.
Hey, we're gonna beat our win total.
Some of my friends say this is the year.
Right.
So
well, at least win more than last year.
Okay. All right, we're out of here. Okay. Thanks very much, Dr. Brian Amison from the Amison Dental Group. We appreciate you coming on the show today. Special thank you to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and NeuroCare. No, not NeuroCare. NeuroCare Center, I'm sorry. Technical producer J.D. DeAngelis. As always, thank you for listening. Listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy weekend. We'll see you again next Friday at 9 a.m. right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.